Beautiful, excellent. We understand that there's a lot of people out there who have gone through trauma, who are experiencing emotional, mental, and even physical pain. And even women who are going through pregnancy who have certain fears. So Nini and I today would really like to give you an update as a couples and an insider's look at how we're using timeline therapy, first of all with ourselves, but also with our friends and families. So Randy Place, thank you so much. Great to see you there. Gemma, great to see you there. So yesterday, or the day before,
Yes.
Nini was experiencing some really severe pain in the stomach. Now, she's pregnant. She's how many months?
6.5.
She's 6.5 months pregnant. And there's this unexplainable pain. You went to the doctor.
Yep.
What did the doctor say?
Doctor was quite surprised that I had very early contractions.
So early contractions.
Yes.
But you're only how many months?
6.5.
And the baby's supposed to come out when?
At the end of May. Yeah.
Oh, oh, pick that up. Oh, she just gave birth. So she's not due for a couple of months, but there's this unexplainable pain. So in timeline therapy, and what we know about emotions is that unresolved emotions can cause a lot of pain in the body. So knowing what we know about Chinese medicine is that the best place to remove pain is by going back to the root cause, going back to the very cause of the problem. Now, knowing that Nini's pain was unexplainable, we had to think differently. So, as couples do, you go to bed and you lay down and you do timeline. No pump. No pump. No pump. We do timeline therapy. So we're laying down and Nini said, can we do some timeline therapy together? And I thought this was a great opportunity to test these skills because unresolved emotions at an unconscious level create a lot of pain in the body.
Yeah.
So Nini's very skilled at timeline therapy. We all have layers of emotions. So we started to peel away these layers of emotions to look for this trauma and to understand where this pain is coming from. So as we start to do the process of timeline therapy, we always start by eliminating the emotion of anger because anger is the base level where everything else resides under. So we started to do timeline therapy.
Yeah.
And for those of you, good morning Claire, who would like to understand about timeline therapy is a regression technique. So when we started working on the emotion of anger, what was the first event of anger that you recalled during the timeline therapy session?
Was when I was 4 years old and I have a constipation. I couldn't poo, and as you know that most of the pregnant women they were experiencing some stomach problems, and just when I recall that memory, I was really upset, and I feel like nobody can help me to do the poo. So and once I released that, it's really funny. Daniel forgot to mention, before we started timeline therapy, I asked him to touch my belly on the left-hand side of my belly. And it was really hot, the heat.
A lot of heat.
A lot of heat. So once we released the first one, it's really funny, the belly start have a little bit more movement. So maybe, the Caesar inside, he can feel it as well.
Caesar's the baby's name.
Yeah. So, and the heat, I just feel that there's something is kind of like releasing. It's really hard to explain, but that was the first event, when we did the timeline therapy. Yeah.
So let's unpack it. The first event that she recalled was at age 4. And the memory was of her being constipated and not being able to poo. Now, the memory and the pain that was associated with the memory was in the same place as she was experiencing pain today. So Nini's 37.
Yeah.
We're talking about an event that was 33 years ago. That was unresolved, where she was angry and frustrated because she couldn't poo.
Yeah.
Now, for the mums out there, if you've been pregnant before, you understand that as the baby starts to grow, the skin stretches, the muscles start to stretch, but the cavity where all of your organs, everything gets compressed. So it's a lot of pain. So Carl Jung talks about synchronicity. And think about it like this. An unresolved event that happened 33 years ago that had a strong emotion on it was causing pain in her body in the same place as she's experiencing pain now.
Yeah.
And it was causing heat, which is, often when there's an infection in the body, it causes heat. Now, the heat was in there. And when she released the emotion, the tension started to leave the muscle.
Yeah.
So did the pain. Interesting. So that was anger. What about the next one? So after we release anger, we start to release sadness, because sadness sits under anger, but there can be a lot of anger in sadness. So tell us about sadness.
I think the sadness was when I back in the junior high school, and I have a lot of high expectation from my parents. So, in Asia, you have to go to school very early. But actually, I told my mom, said that I have to go to school early because I have to study. But actually, I was meeting my boyfriend. So that was...
You had a boyfriend?
Yeah, that time.
You had a boyfriend?
Yeah.
Before you met me?
So I think from that time, I feel like, people give a lot of expectation, on me, but in some way I feel I have to cover and lie about it, and that made me feel a bit sad. I mean, sad for myself as well.
So
I feel I couldn't be true me, a real me.
In that memory where she had a boyfriend before me, where was the pain? Where was that emotional pain? Was there emotional pain with that?
I think that was more like around here. Yeah, but like when I think about when I back to that event. Yeah.
So we can see even an unresolved event in the teenage years is still causing an unconscious pain. Now, at this stage of working together, the pain level was at what out of 10? If you think back to it, what was it out of 10?
I think when we did that, I told you my pain was like 10 out of 10,
So
like just so painful.
Pain is 10 out of 10. And Dr. Tad James, he says, any unresolved emotion at an unconscious level, left unattended, causes a lot of pain in the body. Hey, Kate, how you doing there? So we've got rid of anger, we've got rid of sadness, and then we got into fear.
Yeah.
Now, mums out there, if you've ever given birth, you've probably experienced fear. So let's take you back to 2012 in this memory. So we've got to go back to 2012. So share that fear that we uncovered.
The fear was I was in the operation room. Actually, it was unexpected C-section actually, because I was thinking to give the natural birth.
So this was when Nikita was arriving, 2012.
Yeah, so but we wait for like 24 hours labor.
24 hours in labor.
Yeah, but couldn't dilate it, and the doctor
2
said
centimeters dilation.
Yeah, so doctor said was kind of in danger because my blood pressure just go really, really high. So he said that we have to go straight into the operation room.
With the risk of death for Nini.
Yeah, so I think that time I was like, I don't know what to do, but I have to do it. And that time Daniel couldn't go to the operation room, which is totally different. Because I said to the doctor, hey, I thought that my husband can come to the operation room because that's what I saw on the movies, on the TV. So he said that not in Taiwan. So unfortunately, I have to went there by myself. And I still remember I was lying there on the bed, and I talked to some of the assistant and the nurse, and I say to them, can you guys talk, say some joke so I can feel relaxed, but nobody, talk about the joke. So I was really intense and nervous in the whole process. So give me a lot of fear. So
this unresolved fear, and if this is making sense, ladies and gentlemen, just give us a little heart there, because we're going to make sure that we're all in the same place on this. So Nini is recalling memories of fear because when she was giving birth, there was a risk of her losing her life because she'd been in labour for 24 hours. Nikita's heart rate was going through the roof because she couldn't squeeze out the birth canal. And then Nini's experiencing fear. And these are things that have been unresolved. At that stage, where were you feeling that in your body?
Just here.
So the location of the fear and the feeling that came from the fear was back down into the belly, the same place where she was experiencing pain. So we released that.
Yeah.
And then we had to go to the emotion of guilt.
Yeah.
So did we do hurt?
I forgot.
I don't think we did hurt.
No.
We moved on to guilt.
Yeah.
So guilt's a very heavy emotion. Let me tell you something about guilt. There's 5 different types of guilt. And guilt changes the subjective weight of your body. People who experience a lot of guilt, the emotion of guilt, find it very hard to accurately determine their weight. So, guilt being a very powerful emotion, have a listen to how it was impacting Ninny. Now, mums, listen to this. Other people who are experiencing trauma or pain, this is very important. So,
Yep.
the guilt. What was the guilt about?
I think that was a time when we moved back to Australia in Sydney, and Daniel has to work so hard. So as a new couple and with a new baby, sometimes I feel I didn't do very good in parenting. So when I feel I have to deal with that guitar by myself most of the time, and sometimes I think that I couldn't control my emotions. I have to, when she's not listening, I have to use very harsh tone or have to yell at her. And in some way, I feel, very guilty about it. I feel like, oh, I'm not a good mom. I didn't do a good job. So unconsciously, I was thinking that, what should I do when the second babies come? What can I do it differently? Because I want to be a good mom. I want to be, give all their love. I know I love her and I love them, but sometimes when you have that moment, you just don't know how to balance it. So I think I probably unconsciously give myself some of level of the pressures as well. Yeah.
So the guilt was causing pain emotionally. And if you've ever felt guilt before in your life, you understand that it's a very heavy emotion. And what we tend to do with guilt is we try to sweep it under the rug. And what we know about this intervention with Ninny is that she had swept that guilt under her rug, and now it had been left and nothing had been done about it. But this opportunity, this pain that she was experiencing earlier on the week, it gave her an opportunity to peel another layer off that onion, to slice another layer off that layer cake and get rid of the unresolved emotion.
Yeah.
So we'd really done a mental detox. We'd let go of those very powerful emotions, which were targeting pain in the body.
Yeah.
So Claire says, I'm always feeling guilty. That's the thing that's always takes over. Yeah, it's massive. And gentlemen, guys, you feel guilt all the time. We just don't like to talk about it. But this is the time and the place that we talk about it, because these unresolved emotions, they cause pain. And they also impact your levels of health, which is very important. Health is all you got, guys. You've got time and health. You need a lot of time and you need really good health to make the most of that time. So by this stage, we've released these 4 major negative emotions. And what happened with the pain?
I think once we done all the process, my pain is dropped to... It's okay, you can do yourself. Drop to 2 to 3. Yeah, about 2 to 3. It's like really, really, really low. And today I say to Daniel, I couldn't feel the pain anymore. And because the doctor did give me the medication, he said that if you keep having those pain and contractions, you have to start taking those pills and stabilize the baby. So I did take the pill, I think 3 days ago, but that's when I say to you, before we did time therapy, I say, I don't think these pills work because I'm still experiencing a lot of pain. But today, I don't have a pain at all. You saw me start doing some of the chores and, yeah.
So once you release negative emotions, and Jade, this is a great question, where do we let them go? Well, we let them go at the Success Breakthrough. That's the place to let them go, and we'll be doing that in the UK next Saturday, Friday, Saturday and Sunday, 17th, 18th and 19th in the UK. So you've got to be able to let go of these unresolved negative emotions, because left unattended, they cause a lot of pain in the body. Yeah. So Ninny let go of the emotions and the pain went from a 10 all the way down to...
Yeah, but today's like 0. Zero.
And she did it with the mind. So when we talk about root cause, we have to look at what's the cause of this pain, this emotional pain. Any unresolved negative emotion changes the way you think and feel. It changes the energy levels of your body. Very exciting stuff for you to know. Now, if you've had any form of trauma in your life, if you're experiencing pain and you can't identify it, people do this. People go from doctor to doctor to doctor and they look for the cause of this pain and the doctors can't medically find it. The reason for that is that 80% of illness, 80% of disease is psychosomatic. It starts in the mind and then manifests in the body. And this is what Nini was experiencing. She was experiencing a psychosomatic illness, an emotional pain in the body. But we think differently, and we encourage you to also think differently. Now, if you've been experiencing trauma throughout your life, physically or emotionally, then we'd like to speak to you one-on-one. If you've had pain and you can't explain it and you're taking medication, you still have the pain, we'd like to speak to you one-on-one. There's a very famous back surgeon. He was out of New York and he was doing back surgery for 20 years. And after 20 years, he rang all of his patients and he said, how's the pain in your back? And 100% of his patients said the pain was there. Now, his name's Dr. John Sano, and he got out of back surgery because he said it didn't work. And he started to get into neuroscience. And neuroscience is timeline therapy and NLP. So Jade says, this is so strange. I have had a mystery illness for years, and the doctors have labelled it as a mystery. Yeah, absolutely. Because doctors are looking at symptomology. They're not looking at the root cause. And this is what timeline therapy does. It does look at the root cause. It identifies and looks at your medical conditions very differently. It works with, this is holistic medicine.
Yes, because I experienced it myself. I have this medication to help me to stabilize the baby, but the whole day I still experiencing the pain until we did the timeline therapy the other night. And no medication the past 2 days.
No medication, no pain. So if you like that, give us a heart. If there's something that's a mystery to you, then send us a message. Get on the phone. We'd love to talk to you about it because this is a fascinating field. And if you're willing to look at something differently and be open to a new experience, then you could also get rid of those mystery illnesses, because we know that 80% of illness is psychosomatic. So Nini's been through the pain, and she's also realised as a mum, and this is for the mums out there, that we can still carry these emotional scars with us. And if we don't do anything about it, we can have these mystery pains in the body, but we can also pass this down to the unborn child. So as a family, we believe it's your responsibility to unlock your mental blocks, for you to perform at your best so that your children get the best opportunities in life.
100%.
So if you're interested, if you found this fascinating and you'd like to speak to me or Nini one-to-one, you know what to do. You're on Facebook all the time. Hit the message button, write us a message, and we will respond. So wherever you are today, have a lovely day, and we'll speak to you shortly.
Thank you. Bye.